Hi there, everyone. Welcome to another exciting and informative edition of Jamaica Magazine. I'm Katie Aloy Knight, turning the pages with you as we share features with information that can transform lives and improve your well-being. Sit back and relax for all these and more in this half-hour journey you don't want to miss. It all unfolds right after this important message.
Are you living on or in possession of family land? Do you want to sell or subdivide the property? Use eLand Jamaica to search for details on the property. You can complete a title search and verify the owner before you sell the property. If your name does not appear on the title, register the land or clarify the existing title in your name before you sell. A title is a notice to the world of your ownership of land. For more information, contact the National Land Agency at 876-750-5263 or 876-946-5263. The National Land Agency, one goal to serve you better.
Good day, I'm Theodore Henry, and this is your JIS News for Monday, December 1, 2025. Prime Minister Dr. Andrew Holness has announced that the government will be shifting from mass package distribution of Hurricane Melissa relief supplies to a coupon and relief card system. The Prime Minister says the new approach is designed to promote fairness, strengthen efficiency, and protect the dignity of citizens during the recovery period.
I'm also very concerned about the dignity of our people. You know, I don't like my country to be shown as people running to get food, running to get fighting over package and those kinds. I don't like it. So if you have to give, you don't have to, make it, just keep that quietly, man. Keep that quietly. Help the people who are in distress, preserve your dignity. And the people who are in distress, remember your dignity.
Dr. Holness also emphasized the importance of using resources strategically to maximize resilience and support faster recovery, especially for small businesses.
For shops to get back up on their feet, they need electricity. There are some communities that are not going to get electricity right away. So what they will get, we will loan them a generator so that when they get back electricity, we can take that back and give it to another shop. That is how you save money.
Dr. Holness was speaking on Friday at the opening ceremony for the newly reconstructed Little London Police Station in Westmoreland. The $200 million two-story complex was done through a partnership with the National Housing Trust, Jamaica Constabulary Force, and the Ministry of National Security and Peace. The 5,300 square foot structure houses offices, living quarters, detention cells, kitchen and laundry facilities, solar power, rainwater harvesting systems, among other amenities. Meanwhile, Dr. Holness is seeking to reassure residents of Accompong in the hills of St. Elizabeth of the government's commitment to rebuilding efforts following the passage of Hurricane Melissa. Dr. Holness toured sections of the community on Sunday alongside Maroon Chief Richard Curry, visiting areas where the roofs of several buildings were torn off during the storm. The Prime Minister says every effort will be made to restore essential services and rebuild infrastructure in time for its annual Maroon Festival scheduled for early January 2026.
And as you are putting in your own effort as a community, you still need electricity. And it is not Chief Curry or benefactors from overseas who can do that. It has to be the government that works very quickly to try to establish that. You need water, your schools, you need the agricultural restoration, the restoration of your roads and commerce. These are things that the government has to do.
During the visit, the Prime Minister also handed over a generator and Starlink system to the Accompong Primary School to support its connectivity and operations during the recovery period. Minister of Health and Wellness Dr. Christopher Tufton has welcomed the establishment of the Barbados Field Hospital on the grounds of the Savannah Lamar Public General Hospital in Westmoreland. The facility is expected to become fully operational this week. It was set up by the Barbados Defense Force BDF Emergency Medical Team led by Lieutenant Commander Anderson Goodrich in close collaboration with the Jamaica Defense Force JDF. The unit is staffed by more than 60 medical professionals and is equipped with operating theaters, intensive care units, and staff accommodation. It also features food services, independent power generation, water management systems, and waste disposal infrastructure.
This is a positive aspect of our otherwise tragic circumstances, the collaboration that has been established, the friendship, and of course helping people, because at the end of the day this is about helping the citizens of our communities who have been impacted. And this is what this facility will do.
Senior Medical Officer at the Savannah Lamar Hospital, Dr. Saman Vimo, says the addition will significantly strengthen service delivery.
So when we have these kind of services, definitely is going to allow us to provide uninterrupted medical care, and it also allow us to give some rest for some of our staff who are really struggling to balance in between work and household issues.
Clinical Medical Director of the BDF team, Captain Dr. Ayana Critchlow, says her team is pleased to support Jamaica's recovery efforts.
We've worked out our flow patterns from their emergency room through in our triage. We have critically placed a few of our doctors to work in the hospital that would then help to funnel to our hospital. And we've actually worked out some rosters with the accident emergency consultant, Dr. Mills, along with Dr. Vemu and the surgeons, on how we will flow as well as manage the inpatient overflow.
Jamaica is set to receive an additional US $4 million from the United Nations UN Central Emergency Response Fund, CERF, to accelerate life-saving humanitarian activities in parishes hardest hit by Hurricane Melissa. The funding will be channeled through 5 UN-affiliated agencies: UNICEF, the International Organization for Migration, IOM, the Pan-American Health Organization, PAHO, the World Health Organization, WHO, and the World Food Programme, WFP. These agencies will work in close partnership with government ministries and agencies, as well as the Office of Disaster Preparedness and Emergency Management, ODPEM. The announcement was made by UN Resident Coordinator in Jamaica, Dennis Zulu, during a special press briefing on Hurricane Melissa recovery at Jamaica House recently. This new allocation follows an initial US $2 million in resilient recovery grants mobilized by the UN to support Jamaica's hurricane recovery efforts.
The IOM will focus on emergency shelter and non-food items for 8,800 of the most vulnerable people in Westmoreland, Hanover, St. James, and Trelawney, prioritizing last-mile delivery to families whose homes and possessions have been destroyed. WFP will provide cash-based assistance to 10,756 beneficiaries supporting hurricane-affected households in priority parishes to meet their food and essential needs. UNICEF will lead water and sanitation and hygiene response, reaching over 220,000 people with emergency safe water, restoration water supply systems, hygiene and sanitation support.
Mr. Zulu added that the expanded funding will also enable greater access to healthcare services.
PAHO WHO will support continuity of essential healthcare for 600,000 people, including medical supplies, urgent repairs to health facilities, deployment of emergency medical teams, and mental health and psychosocial services.
Over in education, the Ministry of Education, Skills, Youth and Information is moving to strengthen disaster readiness in early childhood institutions through the development of comprehensive emergency preparedness guidelines. The initiative is being shaped by lessons learned from the devastating impact of Category 5 Hurricane Melissa. Portfolio Minister Dr. Dana Morris-Dixon announced the move during the Dudley Grant Early Childhood Education Resource Center Colloquium 2025, held recently at the UWI Regional Headquarters in St. Andrew. She explained that the guidelines will be developed in collaboration with the Office of Disaster Preparedness and Emergency Management, ODPEM, and other key partners to ensure a more resilient early childhood sector.
To prepare better than we did. There were so many schools that I've been to, and we just put in computer labs. And all of the computers are wet. all are damaged and destroyed. Some schools had particular lockers that they used, and those survived, but many didn't. And so even just how we prepare for our hurricanes or any disaster is really very important.
Minister Morris Dixon also underscored the urgent need to strengthen crisis leadership within the education system.
I've had principals and teachers say to me that I don't know how to lead in a crisis. So we now need in our teacher training institutions to have crisis management as a compulsory course.
As part of the ministry's strengthened approach, early childhood institutions, particularly those in disaster-prone areas, are being encouraged to regularly review and test their emergency plans to ensure they remain fully prepared for any major event. The Ministry of Education, meanwhile, has confirmed that 845 schools have resumed operations following the passage of Hurricane Melissa. This includes 24 of the 25 high schools in Region 4, which have reopened for students in grades 11 to 13 to support preparations for the upcoming CSEC and CAPE examinations. Region 4, comprising Westmoreland, St. James, and Hanover, was among the areas most severely impacted by the storm. Portfolio Minister Dr. Dana Morris Dixon, who made the announcement during a recent press briefing, commended principals and teachers for working closely with the ministry to restore normality across the education system.
We're expecting that within the next 2 weeks, we'll be able to get all students back in, but it will be on a rotational, a shift basis, because we're looking at the parts of the school that we can use and using those parts. So everybody won't be in every day. So that's the interim solution. But our focus has been on bringing in those students who have external exams.
And finally, Chief Executive Officer of the National Health Fund, NHF, Everton Anderson, says the agency's pharmacy services are almost back to pre-Melissa levels. Mr. Anderson provided the update during the handover of $40 million worth of medication from Dr. Reddy Laboratories Limited on Tuesday.
For Westmoreland, we have surged ahead in that parish, and I think Black River is a little ahead too. So we actually processed a total of 148,000 prescriptions the first 3 weeks after the hurricane, and this is a 1.6% increase over the 3 weeks before the hurricane. So it means that we are serving the patients. We visited about 50 communities, very remote service areas, including using a bike service to get to patients.
All major NHF pharmacy locations are now operational, with prescription filling resumed at over 90% of the public sector facilities served by the fund. The remaining 10%, which suffered significant structural damage, are being supported through mobile pharmacy services. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.
The Statistical Institute of Jamaica Statin will be conducting the 2025 Jamaica Survey of Living Conditions JSLC starting August 2025. For over 30 years, PIOJ analysis of JSLC data has helped to shape national policy, including on education, healthcare, and social support. When the JSLC team visits your home, participate. Your voice helps guide real solutions. For more information, visit statinja.gov.jm or WhatsApp Statin at 876-569-1083.
We are turning the pages now to get some important ideas on how to improve our personal food security and to become more resilient.
Urban gardening is the cultivation of vegetables, fruits, aromatic plants, and herbs in an enclosed space or your backyard. It's an ideal way for those with little space to participate in the process of food production, saving money while feeding themselves. Practical Practical application is one of the best methods of imparting new knowledge. The Jamaica 4-H clubs ran with that concept when it set up an urban garden display project at 123 Duke Street in downtown Kingston.
This project was born out of the COVID pandemic, where we recognize that food production has to become everybody's business. Traditionally, most of our food in Jamaica is cultivated in rural areas. We believe that even if you are in a dormitory community without land space, we believe that there's still an opportunity for you to produce. In this urban model, you would realize that we are demonstrating how you can do air planting, how you can do planting on your fence line, how you can produce food in different medium. And so we are utilizing a fully integrated approach from collecting your own water, by generating your own nutrient within the urban garden model setting, to be able to produce the food that you will eat.
There are a few vital things that plants need to grow. These include sunlight, proper temperature, moisture, air, and nutrients.
One of the basic pieces of technology inside our urban model garden is to demonstrate rainwater harvesting. From your roof, you're collecting your water, not only your roof, but just anywhere there's a runoff, because it could be a runoff underground. And what you want to do is to be able to have some storage capacity.
In the 4-H urban garden, the water is stored underground to ensure there is more available space on the surface. Of course, your environment will determine the most effective setup for your system.
One of the good things about Jamaica, other than when we have night, we always have sunlight. There are some plants that requires a lot more lighting than others. And so one of the things we demonstrate or we share with urban gardeners is where you put what. So there are some plants that you can do indoors. There are some plants that will strive and do better if they were to be grown outdoor. Whether you're using container, you're using your fencing, you're using backyard, front yard, or your rooftop. Another feature that is demonstrated here is composting. To my right is our composting area, and we have a roto-composting bin, as well as we have a regular bin. And in fact, just about all the vegetative matter and the waste from the birds and the animals across there are in fact all placed into our composters, and that is broken down to provide organic matter. Because again, your soil needs that for aeration, it needs it to add humus, and that's what is going to allow your plants to grow well.
And all this can be done in your own space. Livestock is another avenue you can choose in your urban gardening. Rabbit rearing is an excellent source of protein, and it doesn't require much space. You can also use the plants in the garden to feed them. Other animals can be included, such as chicken and fish.
We do a lot of different birds here. You can do your ornamental fish, you can do your tilapia, and you can also do your domestic hens. Because that's something we are also promoting, is to get back to those domestic hens for eggs and meat. There are many things you can do in terms of livestock. It's almost as diverse as you're going for crops.
To replicate this model in your urban space, speak with your Jamaica 4-H Club's parish officer. You can receive seeds and other planting material to get you started.
One of the biggest threats right now in the world is not war or COVID, is really to have a sustainable supply of food. And the view is that no longer can we only rely on the traditional food producer. I think food production has to become everybody's business. And I think the extent to which we are able to get all our people to produce some of what you will consume, I think is one of the greatest steps we can take in looking at the phenomenon of food sustainability.
A strategy the Jamaica 4-H Society has started to aid in maintaining sustainable food within communities. And if you haven't begun the process in your space yet, You can start now.
The shadows of October 28, 2025 still linger, the aftermath of Category 5 Hurricane Melissa. The powerful system made landfall in Jamaica, leaving a trail of devastation across the island. While every parish felt its force, the western end bore the brunt of the storm. Many residents are still without homes, vital infrastructure has been wiped out, and communities are struggling to rebuild. As a nation, we're all picking up the pieces together. Let us continue to stand united and support recovery efforts by donating through the country's official disaster relief and recovery portal at supportjamaica.gov.jm.
The theme for World AIDS Day is Overcoming Disruption, Transforming the AIDS Response. Jamaica joins the call for human rights-centered approach to end AIDS by 2030. It's an illness that can affect anyone and is now treatable, and transmission is preventable. No need to stigmatize. This feature gives you the facts.
Fact: HIV is no longer a death sentence.
With a treatment regime inclusive of antiretroviral drugs, an HIV-infected person can live a long, healthy, productive life.
With proper medical care, HIV viral loads can become undetectable and therefore untransmissible.
Fact: controlled HIV cannot be passed on from one person to the next.
Despite this information, fears about contracting HIV from social contact remain. And HIV-positive persons continue to face stigma and discrimination.
What we have found is that while we have treatment that is free, while we have health facilities across the country that allows services to be available and accessible, we also have our own NGO, the Jamaica AIDS Support for Life, that also provides services for people living with HIV. We still find that persons are still afraid to access the services. And this issue is related to what they think or what they perceive or what they think is real when it comes to being discriminated against. So discrimination is persons are being treated in a disrespectful way. They are being asked questions that are not necessarily relevant for the reason why they're in the space that they're in and when they're asking for services. And these are concerns that we have had over the years.
Government, through the National Family Planning Board, NFPB, intends to end this practice with the launch of its Champions for Change campaign. A constant partner is NGO, the Jamaica Network of Seropositives.
Now, as a person living with HIV for over 23 years, it wasn't easy, it's a bit challenging, but I first learned to think about me. What other persons think or perceive me to be, it really doesn't matter. Because in life, you still have challenge. You will always have challenges. You will always have persons liking you or not liking you. But at the end of the day, you still have to live. You still have to go on with life. And I try to tell persons, do not let HIV stop you from living. It's about looking at yourself and said, okay, yes, I've contracted the virus, but guess what? I am going to live no matter what. You know, do not let HIV stop you from doing nothing. You want to be a hairdresser, a teacher, a doctor, you can still be what you want to be in life. It doesn't stop you from accomplishing anything you want to accomplish. But what stops you is the fear of what others think. What I want people to understand is that persons living with HIV, it's your brother, your sister, your neighbor, your friends. And HIV is not something for us to just look down on an individual and say, listen, because you're HIV positive, I don't want anything to do with you.
A 2019 Stigma Index survey among 509 HIV-positive persons documents that the most common forms of stigma and discrimination experienced is gossip, unfair remarks, and verbal harassment.
So sometimes when you go into your office space and you hear persons speaking, they might be just talking to your friends and everything. Stop them. You don't know who is in your office. You don't know who is in the household. Be careful as to what you say and how you say it, because sometimes we're just very unkind and we say it for joke, but it's not a joke. We are hurting persons. Persons are being hurt. Persons are afraid. The sad part about it is that when it really gets to you, it becomes self-stigmatizing. And when you have someone getting up every morning and when they look in the mirror, they're not happy with who they see, that's a lot of self-stigma happening, and they are unable to function effectively.
And a lot of persons who are positive figure more or less that they can have kids, but they can still have a family. They can get married, they can have children.
HIV status is not a big deal. Persons can manage it. When we came up with Champions for Change, we believe that truly it's time that we have full support. And what better way to get full support than to have persons championing the cause of other persons? It's your brother keeper concept. It's where you can stand up and say, listen, enough is enough. I see you bullying someone. No, stop. Stop bullying this person. It's not fair. It's unreasonable. They have not done anything wrong. Especially when it comes to your HIV status, especially when it comes to your health status.
So when a person come in, you embrace them, you show them that regardless of the fact that they may be sick, you still love them. And that is the key medicine, you know, that you don't laugh at me and behind my back you talk me. That's not love.
It's important that I am a voice of compassion, I'm a voice of love as a medical doctor and just as a human, so that I can really speak on their behalf and kind of encourage people to show love. Very important for me is the promotion of education. I find that as much as I think people know about HIV over all these years, some people still don't remember that you cannot get it from touch, you cannot get it from hugging someone. And they only think it's from sexual intercourse. They don't remember that you can get it from a blood transfusion, or possibly you could be born to an HIV positive mother. So in educating the populace and in educating the people, they will remember to show love. Myself and other champions have been speaking to a lot of important groups that have large reach, the Scouts, the JPs, and also using our social media platforms as a method to reach out to larger audiences. Each and every one of you out there is a champion, and you should actually be that voice. You should actually stop people from troubling people, teasing people, bullying people, discriminating, and encourage love, compassion, and just again, be a brother, be a sister, be someone who truly cares for others, as HIV is not going to be transmitted to you from a hug or from a touch or from sitting beside a coworker. So let's all be that champion for change, and let's all just show love and empathy in all that we do.
Do your part. Show love, show support, don't discriminate.
Our half-hour journey through the pages of Jamaica Magazine ends right here for today. But please join us again tomorrow on this station for more news, features, and information you can use. In the meantime, visit our website at jis.gov.jm for this and other offerings. On behalf of the entire production team, I'm Katie Aloy Knight. Till next time, take care and lend a helping hand where you can in this time of need.
This has been a production of the Jamaica Information Service, the voice of Jamaica.